Radio Bandido, broadcasting nationwide on 50,000 watts, streaming worldwide on facebook.com/DZRJ 810 AM.
Radyo Broadcasting Network Incorporated, member KBP, kapisanan ng mga broadcasters sa Pilipinas.
DZRJ 810 AM is committed to bringing you the latest updated news that's important to you throughout the day. The Philippine Star is the trusted source for accurate, in-depth news coverage. DZRJ 810 AM, the voice of the Philippines, is proud to join forces with the Philippine Star, ensuring that you get the most accurate, trustworthy, and timely news that you can use all day long. The voice of the Philippines and the Philippine Star, teaming up to bring the news to you. We welcome comments from our listeners, whether it be on issues or our programming. Our phone numbers are 897-8374 and 895-4460. You can also email us your suggestions on our programming. DZRJ 810 AM, the voice of the Philippines, heard nationwide and all over the world via the internet streaming, which can be accessed via rjplanet.com. We repeat, our phone numbers are 897-8374 and 895-4460. Thank you for listening.
The views and comments of the hosts and guests are not necessarily those of the station.
Radio Bandido, 810 AM.
Yes, magandang tanghali bayan. This is Good News Pilipinas. Francis de Guzman, your host and co-producer. And it's a sunny day and a warm, really warm day. The past days we had 42 degrees body heat index, and that's terrible. And the traffic is really terrible. I mean, you know, it took me about an hour or more just to prepare and to come here in our studio. Please forgive me, I was a bit late. But the good news is that we are back with the very wonderful guest, you know, Father Luke from the Pacto Catholic Church. And Doctora Marisa. Wow, welcome po, Doctora.
Thank you. Thank you very much for your invitation.
And our brother, my friend for 4 years together, we were in San Beda with the Benedictine group. 40 years. Okay. Mabuhay po kayong lahat. Aming mga kababayan sa iba-ibang bansa. Our OFWs are watching us worldwide, and Filipino expats and foreigners, Father.
Yes, great.
We reach as far as Europe and as far as Alaska, and all over the world. We are reaching worldwide, and thanks be to God, because the gospel truth will be shared, and the encouragement of people like Father Luke, Dr. Marisa, and Brother Sunny here, who is an advocate of mental health awareness. You know, folks, this is our third session, actually, Doctora, and you know, I'm reading what Brother Sunny just gave me a while ago, implementing rules, regulations of the Republic Act 11036, otherwise known as the Mental Health Act. You know, Brother Sunny, thank you for the good news. I got your message last night.
Yeah.
Oh, wonderful news,
what
folks.
message was that?
About the mental health law.
Oh, yeah.
Wow, grabe. Mr. President, President Rodrigo Roa Duterte, saludo po kami sa inyo, sapagkat ang puso po nyo ayan sa ating bansa at sa ating mga kababayang Pilipino.
And don't forget to mention Senator
and Senator
Ontiveros.
Risa, yes. So one of these days we will have you here with our special guest here today.
Yes.
Father Luke, I'm so excited. Can you share us what has happened since the last time we did our second session?
Well, both related to what happened after this and the Mental Health Act.
Yes, Father.
We are extremely very happy. Mental Health Act, like so many major aspects, come from different people, not just one.
Yes.
And you mentioned already the Senator, we mentioned the Philippine Psychiatric Association.
Wow.
The parents, relatives in general of patients, recovered patients have been involved. I think I mentioned it already,
yes,
but that act has been laying in Congress for I don't know how many administrations.
Really?
Nothing happened. Nothing, not even a vote against it.
Oh.
Nothing. And now this time, well, in 2018,
Yes, Father.
it passed not just with flying colors, with unanimous, not one vote against it. That happens
Wow.
almost never. I must admit,
something
I'm
to
not
be,
aware
oh.
if there was an abstention.
Yes,
But in
Father.
the House of Representatives, nobody against. In the House of
Terrific.
Senate,
Look
nobody
at that.
against.
That's the
That
miracle,
happens
Father.
practically never. Now,
Yes.
now, I must admit, since I've been saying that this happens almost never, I did hear though about one law that passed also unanimously to increase taxes.
Father.
But I mean, the regular law is very extremely happy, and we are not the first in the world, but we're among the first in the world to have such a kind of mental health
First
act.
in the
No,
world.
not the very first, but I mean among the top.
Among
Yeah,
that,
yes.
oh, that's
I don't
good
know
news,
who is the
Brother
first,
Sunny and
because
Dora.
we didn't have an exact list
Yes.
of 1, 2, 3, but we're surely among the top. And one
Terrific.
aspect is the abolition of solitary confinement.
Oh, that
well,
is
it's
very
not yet a
important.
total
Wow.
100%, but at least 99% abolition. And I'm very, very happy for that.
Terrific, huh?
And I'm
Buhay.
involved,
Ang ating
I'm
bansa
involved
for
with
that.
the IRR, implementing rules and regulations.
Yes,
Dr.
Father.
Also, and we are pushing that, but the whole mental health act. But surely, with special attention for the abolition of the solitary confinement. So we are very happy.
That's very important, Father.
Yes.
Father, you have a partner pala here in
Yes.
the alliance.
Yes, sure. Our
Yes.
main
Doctora,
person. Yes.
Marisa,
Yes.
Doctora, can you give us more about your details aside from being with the alliance with Father
Filipino
Luke
families.
and Brother Sunny here?
Yes.
Yes.
Okay, good morning, everyone. Hello. I'm Dr. Marisa de Guzman. Yeah, the same. We're the same. Sabi ko,
Kamag-anak ko ba ito?
That's right. So I'm as an associate professor of the University of the Philippines College of Medicine. So I'm with the Department of Psychiatry and Behavioral Medicine. So for the past almost 18 years. No? So,
Terrific.
yeah.
Wow.
Anyway, more than anything, my advocacy has
Yes,
always
po.
been to help families taking care of patients suffering from a chronic mental illness. And this is the reason why my involvement with the Alliance of Filipino Families has been there from the very beginning.
Uy, ang
Because,
ganda, no?
yes, because the Philippine General Hospital has inpatient charity patients. And what has happened for the past so many years is that you have patients going in and out of the hospitals, like a revolving door phenomena. Yes.
Grabe.
They go in and then they go out well, and then the families take care of them, but eventually pag nagwala o nagalit o may ginawa, balik na naman sa ospital.
Oh my goodness,
So with this,
terrible.
we had to address the problem, and we
Yes.
realized that we had to help the families. Families have to be part of the management and treatment of
I
people
agree.
suffering from mental illness. So if we educated families who were with the patients 24/7, we empower them, then they are able to help their patients in the best way possible. Because from the Alliance of Filipino Families, we've always believed that family is the key to recovery from mental illness.
Ayan.
That's why when this law came about,
Yes.
which is human rights based, the only human rights based law, I believe,
Terrific.
no, for patients, for health, mental health workers,
Yes,
and
of
for
course.
those involved in mental health, and also for all the other government agencies. Especially, we like to commend the Department of Health,
Yes,
who
po.
have been spearheading efforts, no, for the implementing rules and regulations of the Mental Health Act, no,
Wow,
and bring
terrific.
it down not only to the hospitals, not to the tertiary hospital, but
Uy,
down to the
gra-
community
To
base.
the grassroots.
Yes.
Uy, that's very important.
Yes.
Dr. Francisco Duque, mabuhay po kayo because
Yes.
You can hear Dr. Marisa
Thank
here.
you, sir. Thank you very much for your support.
Commending your
Yes.
efforts po.
Yes,
Alam mo,
yes.
Francis, si
Yes,
brother of Dr. Duque, si Gonzalo Duque.
Uy, si Gonzalo.
Yeah, he's the
Yan.
brother of
Oh,
Dr.
beda
Duque.
niyan.
Oo.
Oh,
He's now with, I think, GSIS or SSS.
talaga, wow. Kita naman yun, no? Kita mo family. Family is so important, Dr.
Yes.
Marisa, because this is the basic support system. And I'm
Yes,
so
that's
happy
right.
because Father Luke here is the one that brings in the spiritual aspect, you know, of the family. I remember when I was a young boy, you know, Father Peyton would say, the family that prays
Prays
together
together, stays
stays together. there's unity, Isa ang focus, isang value system. It's so important, Doctora, because if that is lost, what happens to the family which is basic, And then if we go back to the Bible, Joseph, and Mary, Father, they took care of the family where Jesus was, and that is a wonderful stewardship that God gave it, and we must never forget it because it goes back to the Word of God.
Yes.
So I'm so happy Father Luke is with us. Imagine Father Luke, 80 years old, Father.
Almost.
Almost. My gosh, he looks even stronger and younger than me. He can walk, Though I was told he walks, sabi ng sekretary niya, pupunta ng MRT, grabe, hindi ko kaya yata yung ginagawa ito, pare. Father Luke, how I wish I knew your secretary. Anyway, Dr. Marisa, tell us more about the programs that you have, At UPPGH, I've been hearing from Brother Sunny and Father Luke every first Sunday
Yes.
of the month.
Every first Sunday of the month, which is from 2 o'clock to 5 p.m.,
Wow.
we have the Bukas Puso at Isip
Bukas
Family
Puso.
Support Group.
Bukas
Yes.
Puso.
At
Okay.
It's a family support group that's headed by families and run by families.
Uy, ganda.
My role as a consultant connected with the Department of Psychiatry is to oversee the activities because I
Oh,
believe
that's
that family have the resources, and if you empower them with psychoeducational programs, then they will know how to help themselves and how to help their patients or family members suffering
Yes.
from chronic mental illness.
Terrific.
And maybe they're the best persons to give testimony to
Oh,
their
yes.
own recovery.
Oh, that's wonderful. Maybe
Yes.
the next portion that we might have,
Yes.
Father,
Yes.
the part
And in
4,
fact,
Yes.
we will have those who have
Yes,
been
recovery
healed,
patient. Yes,
because
yes,
that will
yes,
be a
yes.
living testimonies,
Yes.
Yes.
of what love can do, Father,
That's right.
what comfort can do,
Yes.
because bukas puso means open heart,
Open heart, yeah.
And
And Isip, yeah.
yes, and wonderful Father, because God is the God of love, and puso, it comes from the heart.
Yes. That's right.
Love ito pagmamahal. Brother Sunny, I think you were going to share something with us because you've been experienced with dealing with a lot of people in the Alliance because
Yeah.
you're very active on Sundays,
Yeah,
on the first Sunday of
attend the
the
regular
month.
meeting.
Yes.
Faithfully, he was.
Yeah.
he's-
Faithfully,
Yeah.
Brother Sunny.
Attend.
I thought I should be going there for regularly because that's the better way to understand those with mental illness,
Oh, that's true.
especially my brother who is mentally ill.
Oh, your
So
brother.
yeah,
Oh.
I have to be there because otherwise, if you don't attend the lecture of Doctora, you will never understand what mental illness is all about.
Oh my goodness. Huh?
Usually, you have the patient talking to the psychiatrist inside the room. You don't know anything what they are talking about. You know,
Yes.
it's been going on for so many years. I've been with my brother for 30 years.
Terrific.
Yeah, 30
What
years.
kind? Wow, grabe, Father. Look, that's the
But now
kind of
it's-
love
but now
ministry.
it's- But now it's off medicine. For almost 2 years, it's not taking medicine.
Terrific. Wow, I wish everybody is like you, brother. Yung mga kapatid na ganitulad niya. Folks, you're listening to us worldwide and all over the capital cities of the Philippines. This is a live testimonial of 3 wonderful people here. Father Luke, Dr. Marisa, and Brother Sunny, whose life has been dedicated, to the mental health of our people, our Filipino people. Hindi nila kinalimutan ang pagmamahal ng Diyos, and they share that love in action. Doctora,
That's right.
we have some questions that came in a few days ago kasi we
Oh.
started announcing it already.
Yes.
What would you tell us, are there symptoms prior to the attacks?
Usually what we call the early symptoms or prodromal
Yes.
symptoms are seen even during the child and adolescent developmental age.
Oh
But
my gosh.
as much as possible, we try to use behavioral means,
Yes, Doctor.
improve parenting skills in managing the children and adolescents as they grow up. So it's very important for parents
Yes,
not to label or not to but to teach the children, to know how to discipline them in the
Yes,
proper way. Because sometimes we think na pagpasaway ang bata or very difficult or is into drugs, then that's when it becomes already a more very difficult problem. So as early as then, I think parenting skills are very important, so that parents know how to discipline their children, how to talk to them instead of communicating. Yes, because there's always that communication gap, isn't it, between the children and the parents. So communication between parents and the teachers also involved. Yes. So common behavioral problems can be addressed properly.
Common behavioral problems. Okay,
Yes.
Doctora.
And then very important, yung significant person in the life of the child. If the child has a significant person, it be the mother or the father that she can talk to, relate to, ask for advice, then they will know how to traverse these difficulties in a positive way.
Ayun. You're hearing it directly, folks.
Yeah.
Doctora Marisa's own, she's been with it. How many years, Doctora, have you been
Almost 20.
involved in it?
With the family support group.
Yes, family
I think,
support.
Yeah, we're on our 15th
alliance.
year already.
Uy, grabe, Father. Ha?
Yeah.
And when is the anniversary?
We have it every October. You are invited to the first
October.
yes.
Yeah.
And then in November, the first
November.
Saturday of
Yeah.
November. No, it's I think this coming November 11. We have the 4th National Congress of the
Congress.
Alliance of
The 4th?
Filipino Families
Yeah,
for
yeah.
Mental
Wow,
Health.
wonderful. Yes, Brother Sunny.
Anyway,
Yes.
go ahead, ask Dr. more questions. Just thinking of a
Oh,
question.
good,
to
okay.
ask.
Okay, Brother Sunny, thank you. Doctora, you were mentioning about, the significance of a person. The one that is involved in helping people having these kind of symptoms, Father, I remember, the value system that the church has, it's very important because this is taught from childhood. And in fact, the book of Proverbs says it very clearly. Train up a child the way he will go. And when he grows up, he will never depart from it. So it begins with child and then moves towards the adolescent years. Ano pinaka-crucial part nito, Doctora?
For the one of the things
Yes.
that's very important for parents is to teach, help the children know how to take responsibility for the
Okay.
decisions they make and follow through the consequences of their actions. No, and that's a very important part of the freedom that parents have to teach children and adolescents how to handle. Freedom is one side of the coin. The other
Yes.
side is responsibility.
Freedom and responsibility. I
Yes.
like
So,
those two words.
yes.
Okay.
So, very important for when asking children or making them decide, it's to make them think through things so that they learn to make decisions and
Yes.
own up to their decisions. And if they make a mistake, you cannot just reprimand or
Yes.
scold or say, you have to affirm that it had happened,
Yeah,
but at the
okay.
same time, ask the child, well, let's see what we can do something about it. In that way, you're seconding already problem solving.
Ayun.
Diba?
So, okay,
Yeah,
Doctora.
so there are ways, there are manners of teaching, but these things have to be taught to parents. Because
Ayun.
parenting is not something that's taught to us in college,
Right, that's
right?
true, Doctora. I agree with you 100%.
And we usually role model with the parents that we have. No?
Yes.
And if our parents are able to manage through with good parenting skills, they're no perfect parents.
That's true.
But we
Very
thank
true.
our parents and we love them very much because the first thing that we're grateful for is that they've given us life.
Yes.
And then from then, they teach us to how to administer that life properly.
That's very true. Father, look.
Yes,
you can
absolutely.
Mention.
But yes, the
an
education
addendum,
of parents, they say that being parent is the only job for which you do not go to school, You're supposed to get that so by osmosis, No, you have to learn it also. And maybe there's an aspect where we, in our educational system
Yes.
or whatever in general, should give more attention to.
Very important.
Training parents, formation of parents, whatever you want to call it, but something in that line.
Right, Father.
That they would know better what to do. Like you said, when they're teenagers, it's on before there's a real problem, just an early sign, and absolutely stressing freedom with responsibility. That is, and going to need that the whole life long.
Lifetime. Huh?
Yes,
Okay.
yes, yes. So you have to
Okay.
start that when they are still very young,
Mm.
even before they are adolescents. Yeah, okay, it's your choice, but you carry the consequences.
Mm.
Don't blame me afterwards. And
Yeah.
of course, you try to explain it with the child to
Yes,
grow.
Father. Tremendous. Huh? Look at that kind of an insight, Father. Thank you, Ho.
Mhm,
And
mhm.
Doctora, can you do
Well,
this?
of course, our role as psychiatrists, as
Yes.
doctors, is to already treat
Okay.
patients suffering, well,
Okay.
a family member or patient suffering from a mental illness. And there are diagnoses of mental disorders, but it comes over a course of the illness. No, it's
see.
unlike the medical problems. They can be diagnosed right away.
Oo,
no?
immediate kasi may mga
Given
ano
your
yan.
laboratory
Mhm.
tests,
Oo,
given
yung
your
mga
diagnostic
sa blood and all
workup,
that,
yes.
no?
So you may have hypertension because your BP is
Is so high or
100,
something.
yeah,
Oo, that's
beyond
terrible.
140 over
Ang
80.
taas nun.
Yeah. But it's not the case for schizophrenia. It's not the case for depression. It's not the case for anxiety. It's not the case for bipolar disorder. It's also not the case for alcohol and substance abuse. So what happens is that we have to follow through the the person
Okay.
suffering from over a period of time. You
Oh,
know?
I see.
So and whom do we ask, no, to
Yes.
help us, no, to provide us that information? We have to ask the family member. That's why their involvement in the patient's treatment and management is very important. You know,
Thank you so much, Doctora. That's an
Yes,
eye-opener.
yeah.
Doctora, I have a question. You were mentioning anxiety, no? Kasama ba rito yung depression, yung tension, yung stress and all that?
well, stress can
Yeah.
contribute. You know, stress is normal in everyday life.
Yes, po.
I'm sure you were
Yeah.
stressed out coming.
Sa media, lalo na
Yes.
sa amin.
Traffic,
That's true,
traffic,
Father.
yeah.
Nako. So I went into prayer. I can
Yes.
Normal ang stress sa buhay
Look
natin,
yet
no?
with
With, yes, that's
Father,
right.
nako.
With traffic, with
Mm.
job overload, you know, with
Mm.
deadlines to meet.
Right.
But when the stress becomes chronic,
Oh, so
that
there is a chronic.
Yes,
stress.
there's a chronic and produces chronic stress reaction. Then that's when those are the things that you have to watch out for.
Oy, grabe,
And eventually,
chronic stress
it
reaction.
affects the person physically, psychologically, cognitively, behaviorally, you know, and spiritually.
Ay, oo, kasi kasama yan eh.
Yes,
Because
yes.
man is a tripartite being,
Yes.
body, soul, and spirit.
Yes, that's right.
So, Doctora, you were mentioning chronic stress reaction. Lumalabas ba ito? I mean,
Yes.
you can see that from a person in the
Yes.
first meeting or...
Not from the first meeting, but when
okay.
he talks about what has been happening over the course of over the past few weeks. no?
over the past few weeks,
Yeah.
huh? Okay.
You know. So usually you feel tired most of the time.
Uy, grabe yan. Nakakatakot.
Yes. You feel loss of interest in the things that you normally do. We're talking about depression.
Yeah, depression.
Okay,
Yes.
you have difficulty in sleeping. Sometimes to initiate sleep and maintain that sleep, or maybe have frequent awakenings in the morning because you're very tense or anxious.
Uy, that's
And when you wake up, you don't feel you've rested very well. And then you have change in appetites. Oftentimes in patients suffering from depression, there's significant weight loss of about 15%.
Really? That's
Yeah,
big.
Yes, that's big.
Wow,
It's
15%.
noticeable. More than anything, it's very noticeable. And then cognitively, there's that feeling of guilt and hopelessness, no? That they have nobody else to blame but
Guilt and
themselves.
hopelessness.
Yes. And then,
Grabe.
well, the sad reality is also a part of it. There are thoughts of wanting to kill themselves
Ay, this is
or
a
to harm
suicide.
it. Yes, that's suicidal ideation,
Suicidal.
ideations. Then you have suicidal thinking. Is different from a suicidal attempt.
Iba pa
It's
yun.
them
Oo.
yes.
One
Thinking
minute to the
attempt.
other. Yeah.
Yes.
Ay, grabe.
And then it's different from a completed suicide.
Oh my goodness.
So, those are the concerns that parents have over their children and adolescent, and also those people suffering from depression.
Doctor, you're mentioning all of these things that are eye-opener to all of us in the not only in the media, no, but also worldwide and among our people who are listening to us live. Ano percent ang yung companions mo? I mean, I'm talking about outside the family circle. in the workplace, in the church, among members, church members, among leaders, no, in different areas of life. Anong percent ang impact nito on bringing about depression, anxiety, and bringing about the chronic stress, reaction, and then the person begins to feel so guilty, parang wala na siyang pag-asa, yung hopelessness. It's so important, Father, to have a blessed hope, and all of these are factors that can bring about suicidal tendencies or Doctora, what can you
Well, in terms of the percentage, the prevalence of depression,
Yes.
Let's put it at the global population. 1% of the, at least 1% of the population suffer from serious mental illness, and
1%?
about
Okay.
1%, and about 5. These are those who suffer from schizophrenia or bipolar disorders.
Bipolar,
Yes, and then let's put it at 5% who suffer from mild to moderate mental health problems, like moderate, like anxiety, depression, and you can include also epilepsy, and
that's like
dementia. They're all, because they have behavioral problems. So those are the things. So that's why health services have to be provided not only at the tertiary level but also at the community level,
I
the
agree
primary
with you.
care level.
100% I agree. That's a
So,
wonderful challenge for
yes.
people who are listening to
Yes,
us
that's
now
right.
and
there's
watching us live.
definitely there are efforts of
Yes.
the government to bring down mental health services and make it accessible at the primary care level.
Oh, that's wonderful news, huh? That's
Yeah.
good news, Doctor.
That's true.
Good news.
Ah,
We
that's
work for
wonderful.
that.
Okay.
And we work for that.
Yes, Brother Sunny, you were wanting to tell us something a while ago, and you were going over some materials.
Curious,
Yes.
I would like to ask Doctora, what's the difference between psychiatry and neurology?
Uy,
Very,
that's a good question, Sunny.
And first of all, the similarity, both are doctors of medicine.
Okay, similarity. Okay.
And then maybe in terms of, let's put it this way, yung mga sakit sa utak, sinasabi natin are handled by neurologists,
like
And,
stroke, no?
stroke, spinal cord. I mean, those that have those that as a consequence of the brain disorder, we have cerebrovascular accidents, we have a traumatic brain injury, we have tumors in the brain. Now, pag sinasabi natin psychiatry, sinasabi natin doktor po kami sa damdamin at pag-iisip, di ba? So we handle those mental health problems and behavioral problems that also show in people suffering from a medical illness, like stroke patients, they have depression. Cancer patients, they also have anxiety, so we also take care of that.
I see. That's an eye-opener, Doctor.
Yeah, in the same way, because right now, medicine is very, it's very I wouldn't say fragmented, but it's too specialized.
Specialized.
So you have a gastroenterologist that handles,
Specializations,
you have a nephrologist that handles diseases of the kidney. You have a
very good.
gastroenterologist that handles the diseases of the stomach and the
Yes,
intestines. Now, and then you have a breast surgeon.
Mm-mm.
You have the same way, the specialty of psychiatrists are those that have mental health problems, and those also who have mental health problems with comorbid with a medical health problem.
So it can be a combined thing.
Yeah.
It can happen to a
Yes.
person. Grabe, huh? Wow. Doctor, you were mentioning about a while ago about pag-iisip and damdamin, no? What portion of the yung emotions, extreme emotion that when a person gets extremely hurt, and then that person becomes depressed and parang hindi na niya alam saan siya pupunta, but because the emotions were hit directly, and the people who did it to her or to him are people who are supposed to be,
Those.
in quote, supposed to be people who are supposed to care or supposed to give them love, like, fellow Christians, or fellow workers, or
Family members.
family members. So ano percent what happens to the emotionally depressed person, yung talagang tinamaan para bang bumigay, in other words.
Of course, we have to understand that
Yes.
mental disorders is multifactorial. Okay? Pag sinabing it cannot be a single cause and effect thing.
Yes.
The fact na bumagsak sa examination, na depressed na, tuloy-tuloy
Yes.
na yan.
Opo.
Diba? When you say multifactorial, there are many possible causes to a person developing a mental health problems. Oftentimes, kaming mga doktor, we asked about genetic predisposition. Do you have a family history of any mental health problem? Like a family member suffering from depression, or a family member who had been admitted in the hospital. So we look into the genetic predisposition. We also look into trauma. Yes,
Yeah, that's the
childhood
word I was going to
trauma,
say.
Yeah.
or a very stressful life experience.
Yung
No?
abuse.
Or could be abuse. you
like
know,
people
whether
who almost got
physical,
raped, or,
yes, physical, psychological, verbal abuses.
verbal abuse.
Yes.
Wow, grabe yun.
Those soldiers now went to
And then, yes, that's right. This is
coming from war, especially.
Yes.
Yes, that's true, brother son.
yes, that's right. Armed
Oh,
conflict,
No
no?
conflict.
Those who and people who have
Okay.
been exposed to armed conflict.
Oh, doctor.
Okay, so all these things, and then we also look at the environmental, the parenting,
Yes,
how they were brought up, or they were bullied in school, their childhood experiences.
So it goes
And
back to the,
adultery. All this may contribute to the person having developed a mental health problem. And they have to be looked into.
lahat ng factors na ito.
Yes, all these factors have to be examined.
Yeah, Father Luke, Doctora, and Brother Sunny, we were getting feedback already. We're live. So this is coming from Jojo. Mabuhay ka, Jojo. You've been regularly watching and monitoring us, no? Sa Good News Pilipinas. In simple terms, what is bipolar disorder? Its causes, symptoms, treatment, or preventive measures, Doctora? From Jojo.
Okay, Jojo, bipolar disorder is a serious mental health problem.
Uy, seriously yan.
When you, it was
Wow.
called bipolar because you talk of two poles, the manic and then the depressive poles. But that was how it was looked into before. But now when we talk about bipolar, we talk of the high moments and the low moments that the person goes through in a short period of time. Okay.
High and low.
Yeah, high and low. And this is manifested with symptoms. For example, feeling of grandiosity, that they have special powers, or they have so much
grabe.
money, that they want to spend.
Did you hear that, folks?
Yeah. So, and
Too
that's
much
why
money.
we ask them, if you have money, what do you do with your money? So they go shopping. Sometimes they shop for things that they don't need because they want to give it away. They're extremely very
Become like
friendly.
Santa Claus.
Yeah, they're extremely friendly.
Extremely friendly.
Yes,
Okay.
they hit off with any person.
Really?
Yeah. And they can be the life of the party.
Because of too much money.
Yeah. Well, not necessarily. Sometimes that puts them at risk.
Oh, that
Okay,
is
that
the
puts them
most
at-
dangerous
yes,
thing. Okay.
yes.
Puts them at risk.
Yeah,
Okay.
not because they have so much money, but because they think they have so much money. That's why they want to spend. And sometimes you have people who get into gambling, or who
Yun.
get into,
All sorts of,
credit card debts because they think they have they overshop for things that they don't need.
They do extreme.
Yes, no.
Extremely.
Sometimes they have this decreased need for sleep. They work because they want to work. They want to finish jobs, and they want to be able to accomplish a lot of things. They
Okay.
can. It's amazing. They have
Yes, of
so
course.
much energy. You don't know where it's coming from. Sometimes you think that they work in the morning. Before they start work in the morning,
Yes.
they already go to the gym and spend
My
2 hours, 1 to
yung
2 hours.
physical,
Yes,
hindi
and
biro. Father
Yes,
knows that.
that's right. And then afterwards, they go to work as if nothing, no?
Parang nothing happened.
Yes. They tend to be very talkative, They talk a lot. So,
Doctor, I have a question here. When you were saying about, puts them at risk.
puts them at risk for risky behavior.
Okay.
Risky behavior is
Father, yes.
Gambling.
gambling, alcohol, substance abuse.
Okay. Grabe,
Yeah,
no?
maybe even
Yes,
so
correct.
these are the risky behaviors,
Risky. So,
risky lifestyle behavior. So those are the things that you have to watch out.
grabe, high
The
and
good
low.
thing about
Yes,
it is
Doctora.
that once it's not easy to diagnose a person suffering from bipolar disorder, but they can be treated.
They can be treated. That's the good news.
Yes, that's a good.
Ah,
Exactly,
Father and
that's
then
the good
son.
news.
Son.
The
That's the good news po.
the challenge there
Can
is
be
that
treated.
yes, the challenge there is the person recognizes that she needs help and wants treatment for it.
Ayun. So it is important for that person to
Yes.
recognize.
Nice. Yes.
But paano yun, Doktora, kung hindi pa niya nare-realize na ayun na siya,
Oh, that's where the family members come
in.
You know,
So that's where the love support
yes.
of people from the church, like Father Luke, no? And people like the laymen, like Brother Sunny, you know? The support system is so important.
Very important
Doktora.
because they recognize the behavior. They know that the
Ayun.
person puts herself at risk. They know that the person is not sleeping and needs help. They know that the person has to stop this spending, you know, or slow down in the activities because it's already getting on to affecting one's health. So the first thing is for the family member to accompany the patient to seek help. No, maybe it, and we're not here to blame families because we understand that families don't know. So that's the reason why. Yes. So families don't know what to do. So both of them have to go to a specialist, to a psychiatrist, to seek help because it has to be addressed, and it can be addressed properly if there's a regular follow-up with the psychiatrist. So families need to be involved because the information that's asked by the psychiatry does not depend solely on the family members. The psychiatrists need to ask the family, ano bang nangyayari over the past few years?
So yung history is so important.
History, family history.
Oh.
Tapos dun lumalabas yung mga dispositions, multifactorial cause. You know, may family history of mental illness, then you have history of trauma or a history of abuse or bullying experience in school.
Bullying
know.
experiences can do that?
Well,
Well, one of the factors. Yeah.
Well, one of the factors, Father. Because I remember, you know, in school, no, when we were young, Father, you know, there are those guys, or it happens not only to men, and it also happens to women.
Yes.
There are also women who bully their fellow women. And not only men, no? So it has a strong impact pala ito, no?
yes, that's why schools have to have programs for mental health.
Ayun. Si Father is on the right track, Father. Congratulations po. Sana maraming katulad niya, Father. So, wow, grabe ang trauma. I have a question, Doctor. It's been in my mind this, after our two sessions with Brother Sunny and Father. Yung factor na ngayon ng trauma and all this, kailangan ba yung tao has to move away from that, from the scenery or from the place that is causing or from the people who are causing it? Kailangan mahiwalay or, you know, what happens? Nakakatulong ba yan?
Well, and the circumstances have to be taken into consideration.
Okay,
Context. I mean, you cannot generally say na
not in general.
the child is being abused in the family, so he has to be uprooted or taken away.
Bringing them to another. Yeah,
I think the most important thing is the safety.
Safety, okay.
Yes,
Safety.
for the safety of the family member or the child or the woman
Okay.
who are victims of abuse. So the first thing that has to take priority is the safety.
Safety is the most important.
So if the patient is not, if the woman or the child is not assured of her safety, then it's best at the moment to stay away.
Or to keep out from the source that is causing that trauma and the abuse and etc. No?
Yes. Now, but of course, we do not resort to that right away.
Not
We tried,
immediately.
because we tried to involve other family members.
Okay.
We also, especially in children,
In
to
children,
protect the
lalo na.
child.
Oo.
No? And then for the woman, of course, it's a different case because
Yes.
she is the ultimate arbiter. She has to
wow.
decide for
Okay.
herself that if she wants to go back to a relationship which she knows is potentially destructive to her. So it's her choice pa rin.
Ayun,
But
doktora, you
as
get it
as
right.
as
Oh.
as a
Yes,
health
Dr.
mental health professional,
Mm.
we provide the women with options, no, to seek help and to plan for their own safety.
Okay, options, no?
Yes.
Oh, open yan, oo.
Yes.
Oh, ang
So
ganda, doktora. Thank you so much. You're really an eye-opener, Brother Sunny. Yeah? I'm so happy to have her here.
Yes,
We must
I'm
have a part
happy.
2, doktora. If you're free, I know your tight schedule. You know, we're being honored by Doctor. Our tight schedule is tremendous, you know. Siguro, people will have to learn more about what is mental health in the Philippines, you know. Yung awareness and all that. You folks will be invited on the 4th anniversary nila on this is October,
Yes, yes.
November.
November 11, if I'm not
Uy.
mistaken.
I think so,
Father.
yeah.
And the good news, Doctor, Brother Sunny and Father Luke, our media group that has the Herald Forum, Pilipinas Global, is an advocacy media organization. It's non-profit, no? It's an advocacy of the heart. And by God willing, by July, we will be having that kind of a theme on. And
great.
we are inviting you, Doctor. If I remember right, Father Luke, we
Wow,
invited
thank
him.
you.
And Brother Sunny, you know, to join the others, you know, in bringing in awareness, you know, information, education, and what's happening to our nation today, you know, and our people especially, and the children and the youth, because this is the next generation, folks. When you release the arrow has to hit the target. You release the youth, you release the next generation, the millennial.
They have to be prepared.
We have to be prepared. So I'm so happy, you know, that you guys are here with us. And Doctora, can you give us more or less a brief, a very brief, you know, because we have 5 minutes more. We had been extended. Thank
Yes.
God.
Thank you.
5 minutes, yes.
Yes, yes. Thank you very much for this invitation
Oh, thank you.
to
Also, we're
create
so honored,
awareness
Doctor.
on mental health. No?
Father Luke, thank you.
For all the families out there, no, and for all the patients suffering from mental illness, our family members, I've always told family members, never give up.
Never give up. I love that word.
Don't
Never
give up on your loved ones, no, because there's hope.
Never give.
With the developments in science and technology, no, we have a lot of very good medications.
Yes, of course.
And also, not when you think of treatment, you don't only focus on medications. There's family therapy, there's individual therapy, and then there's group therapy. And all this have to form part of the treatment, holistic treatment and management of the patient suffering from mental illness. Okay? You know, sinasabi ko sa mga pasyente, pag marunong tayo mag-alaga sa ating mga may sakit, sila ang
Opo.
magdadala ng swerte sa buhay natin.
Kita naman yan. You heard that from Doctor. The blessing comes after you.
Yes,
Because-
of course, because
you
God
know,
looks down.
Right,
no?
amen. I
With
agree.
So much
Father Luke
affection.
agrees with
Yes,
me and
true,
Brother
true.
Sunny. It's the love, it's compassion.
Yes.
And so, Brother Sunny, Father Luke, and Doctora, I'm coming up with our daily bread. You know, the Word of God is here. It's wonderful, our daily bread. Sharing a cup of comfort. You know, I'd like to share this with you folks. It comes from 2 Corinthians 1:7, you know. You were mentioning, Doctora, about hope, you know. And our hope for you is firm, sabi rito, no? Because we know that just as you share in our sufferings, you know, so also you share in our comfort. You know, this is a wonderful word of God, you know. And the Apostle Paul here, St. Paul, Father, praises God because he is the Father of compassion and the God of all comfort.
Mercy.
You know, this is found in 2 Corinthians 1:3. And the Lord uses our trials and sufferings, you know, to make us more like Him. You know, I agree with this. I've seen Mother Teresa of Calcutta when she came to the Philippines, and I had the honor to interview her for Manila Bulletin. I was so touched by that wonderful nun, and which is very saintly, Father. And you know, I almost knelt down before her because I saw the aura, you know, and then she tells me, don't kneel down to me. She gives God the glory, you know, and a so humble woman. And that is real Christian life, you know, in action. And so, you know, the God of comfort. He comforts our troubles. He equips us to encourage others. This is what you guys are doing. You know, the alliance, as we share what He did for us during our time of need. See how good God is, no? And as we reflect on Christ's suffering, we can be inspired to preserve in the midst of our own pain, you know, trusting that God uses our experiences to strengthen us, you know, and others, you know, towards patient endurance. Oh, terrific. Like St. Paul, we can be comforted in knowing that the Lord redeems our trials for His glory, you know, and we can share His cup of comfort and bring reassuring hope to those who are hurting. Wow, what a wonderful God. And what a wonderful thing that you're doing, you know. Mabuhay kayo, ha? Ang bait ng talaga ang Panginoon. And there is a wonderful prayer here, you know. Lord, sabi niya, thank you for using us to provide comfort, encouragement, and hope to others who are suffering. You know, we praise you for all you have done. You will continue to do to comfort us through our own afflictions. Amen. To God be the glory.
Yeah.
So, folks, this is Good News Pilipinas. DZRJ, 8:10 a.m. We're live. Mabuhay po kayo, aming mga kababayan. I thank our special guest, Father Luke, Dr. Marisa, and Brother Sunny. They'll be back on part 4. To God be the glory.
Thank you.
Saludo po
Thank you
kami
very
sa
much.
ating OFWs. Amen.
Radio Bandido, 8:10 a.m.
The views and comments of the hosts and guests are not necessarily those of the station.